What's up, everyone? I'm Dr. White. One of the most common questions we get at the Prostate Cancer Research Institute is, I've just been diagnosed with prostate cancer. Dr. White, what's my life expectancy? Now, for a lot of men, this question has a surprisingly hopeful answer. And that's because prostate cancer is often very different from the other types of cancers we hear about, like pancreatic, lung, or colon cancer. When you hear those words, you might think of a bleak prognosis, but with prostate cancer, the survival rates are actually excellent. The promising statistics of prostate cancer. Let's look at the numbers. According to the American Cancer Society, the statistics for men diagnosed with prostate cancer are incredibly encouraging. 99% of men have a 5-year survival rate. 98% of men have a 10-year survival rate. 94% of men have a 15-year survival rate. Now, here is a crucial point that is often overlooked. These numbers are based on data from men who were diagnosed 15 or more years ago. Think back to the early 2000s. We've come a long way since then. Medical technology, diagnostic tools, and treatment methods have advanced by leaps and bounds. If you're a man being diagnosed today, your outcomes are likely to be even better than these impressive statistics suggest, and as medical science continues to evolve, men who are living for another 5, 10, or 15 years will benefit from even newer, more effective treatments. It is like buying a new smartphone today. The one that comes out in a year will be even more advanced, and the same principle applies to medical technology, understanding the exceptions. Of course, we have to talk about the flip side. You might hear stories about men who pass away from prostate cancer, and you might wonder, what's that all about? It usually comes down to 2 main scenarios. 1, late diagnosis. Some men don't get screened, so their cancer isn't caught until it's already at a very advanced stage. In these cases, the disease has had a lot of time to spread, making it much harder to treat. This is a powerful reminder of why routine checkups are so important. 2. Aggressive subtypes. While most prostate cancers grow slowly, there are rare aggressive subtypes that behave much more violently. These are the unfortunate stories that often make the headlines and lead to a lot of fear. This is why it is so important for men with a new diagnosis to understand exactly what type of prostate cancer they have. Most cases are manageable and curable, and they can be controlled for many years. Making smart treatment decisions with such a positive outlook on survival, men facing a new prostate cancer diagnosis need to shift their focus. Priority isn't just about fighting the cancer aggressively, it's about considering how your treatment decisions will impact your quality of life for years to come. In our fast-paced American culture, we often want a quick fix. You might be tempted to rush into a radical treatment, thinking, I just want to get this cancer out of me so I can go back to my life. But this is the kind of thinking you might apply to other, more aggressive cancers. The prostate is located in a very sensitive area, surrounded by nerves and muscles that control critical functions like urination and sexual health. Rushing into a treatment without carefully weighing all your options could lead to long-term side effects that you'll have to live with for the rest of your life. For example, a radical prostatectomy might offer a high chance of a cure, but it can also lead to issues like incontinence or erectile dysfunction. On the other hand, less invasive options like active surveillance might allow you to without immediate intervention. The key takeaway here is to slow down, ask a lot of questions, and work with your doctors to understand the full spectrum of available treatments. Don't let fear drive your decisions. Thanks to modern medicine and those excellent survival rates, you have the time to make an informed choice that will serve both your health and your well-being. Have you ever had to make a big health decision that required you to take a step back and slow down? Share your experience in the comments below. The information in this video is for educational purposes only and is not a substitute for professional medical advice. Always consult with a qualified healthcare provider regarding any medical conditions or before making any decisions related to your health.